All right, so the explanation of our technique. So, phonation resistance training exercise is a structured program that is intended to improve the vocal function of individuals who are experiencing voice issues. The technique primary's objective is to enhance vocal endurance, the intensity by means of specific exercises that are designed to strengthen the respiratory and phonation systems. So there's like five specific vocal exercises that you'll see later in our demonstration, but I want to briefly go over what we're going to get into later. So the client will maintain the sound of ah in a strong, energized voice for a long duration without straining. Two, the client will practice a strong, energized, and sitting and descending pitch glides over the entire pitch range. Three, the client will produce self generated functional phrases at a high frequency while employing a strong calling voice. Four, the client will concentrate on the projection of voice of authority through lower frequency phrases. Lastly, the client will use a strong, energized voice in a conversational speech for 30 seconds to 2 seconds to stimulate and practice being in a noisy environment. So, those are some of our exercises. All right. So, the background of our treatment, we have Dr. Hapner and Dr. Ziegler. In 2009, they created the Phonation Resistance Training Exercise to foster communication, socialization, and vocation in older adults, with a particular focus on the principles of successful aging. Okay, so for right focuses on the tasks that mimic real life voice demands, emphasizing the endurance, power, and control. The functional approach aims to enhance the practical use of voice in daily communication contexts. Two, the client performs exercises customized to their individual vocal abilities and objectives. Their target vocal intensity is evaluated and modified to ensure both safety and effectiveness throughout the therapy sessions. Three, the exercise the exercises are developed to enhance vocal intensity, which is essential for achieving effective phonation, particularly in noisy settings or circumstances that demand projection. So these are some of the theories, and now we're going to talk about some of the minor gaps. So, minor gaps. One, there's limited emphasis on the objective of acoustic and aerodynamic outcomes to comprehensively evaluate its effectiveness. Two, participants may exhibit varying responses to this treatment exercises due to personal differences in their vocal fold conditions, respiratory strength, and their commitment to following exercises in a regimen. Um, Three, there is a need for further research on long term sustainability of the voice improvements achieved through this treatment, as well as a need to follow up with interventions.
So the populations that are seen to be using Forte or phonation resistance training exercises are often older adults who have been diagnosed with presbyophonia, which is a condition that is categorized by age related changes in the voice quality due to atrophy. um, Forte is normally combined with other treatments, but it can be done alone to help support the unique needs of individuals who do have presbyophonia. In a randomized clinical trial that I found, it demonstrated that both the Forte alone and its combination with a training exercise called the expiratory muscle strength training or EMST showed significant improvements in the voice quality among patients who did have presbyophonia. Both treatments showed improvements in the voice handicap index, and also with the Forte and the EMST, neither one was inferior if they were used alone, and then when they were combined with each other, they did show improvements just as much as they were being done by themselves.
So, disorders. What disorders do we treat? We treat presbyphonia mainly, which is characterized by age related voice changes, often due to the vocal fold atrophy and other associated physiological changes in the larynx and respiratory systems. This treatment could also benefit individuals with vocal disorders that affect voice quality and overall vocal function. It specifically targets issues such as reduced vocal elasticity, decreased vocal endurance, increased effort during speech, and vocal fatigue and strain.
Hi, Miss Johnson. It's nice to meet you today. I understand that you have come to us due to experiencing presbyophonia after your diagnosis with Parkinson's. Is that right? Okay, so today we will be doing something called the phonatory resistance training exercises or the forte exercises. I'm going to demonstrate the activities and I need you to just follow after me. So the first step of the forte exercise is we're going to produce a vowel sound for as long as you can in your high in intentional speech voice 10 times. So I'm going to do it first and then I need you to do it after me. Good. I like that effort. So next I'm going to recite some functional phrases. We're going to do 10 of them. And when we say them, we will say them as if we're calling for our neighbor over the fence. So with a higher pitched voice. So I will say the sentences and then you will repeat after me. How are you?
How are you?
I am fine.
I am fine.
Where are you going?
Where are you going?
I am going home.
I am going home.
Who is that on the phone?
Who's that on the phone?
It was for you.
It was for you.
I am in a hurry.
I'm in a hurry.
Is it time for dinner?
Is it time for dinner?
What's for dinner?
What's for dinner?
What are we having?
What are we having?
Thank you so much for participating. Next, I'm going to have you speak with my co-clinician about some strategies, resources, and some precautions that you can implement outside of therapy.
So Forte has been shown to really increase the vocal quality of life and improve vocal quality by reducing vocal strain. So it's good to make sure that you do these exercises every day at home, just like you did in here. And that's just going to help have better outcomes for your voice over time. There's an organization called Dysphonia International that you could reach out to, and they have some support groups they can connect you with if you're interested in that. That'll connect you with others who are kind of going through the same struggles that you might be facing right now. And they also have a lot of research and a lot of different tools and resources you can utilize on there. And just some precautionary things you can do at home is avoiding acidic foods and making sure you stay hydrated and drink a lot of water throughout the day. Those are going to really help just maintain the healthiness of your throat overall.
Thank you for coming in. Do you have any questions for us?
So, digging into the real world application of Forte. So, Forte is considered highly relevant within the clinical setting. During the treatment of older adults who have presbyophonia or changes in their voice due to their age.
As people age, their voices become weaker, breathier, and harder to project, which in return makes it difficult for them to socialize in certain environments. And this is where Forte comes in. This exercise helps target individuals' vocal strength, clarity, and their endurance. In a study I found by Belsky, he emphasized the importance of SLPs and how they play a crucial role in managing dysphonia in the older population. The supported evidence that Forte is clinically relevant. And also during a randomized clinical trial, Belsky showed that Forte used with and without the addition of EMST, which we talked about earlier in our presentation, led to improvements by itself in the vocal function of patients who reported their voice outcomes. These findings demonstrated that Forte is effective and that it is adaptable. So, to dig deeper into the real world application, Forte can be delivered in various settings, and like outpatient clinics, voice centers, telehealth, and it's helps with the older population because it's very accessible, as well as some of the barriers due to the population that it targets could be physical and cognitive limitations, as well as patient motivation, and then clinical training of Forte from SLPs. Some SLPs may not be trained to use Forte, or um, they might not want to be trained in it, which is sad. But not being able to have SLPs that are trained in Forte could be a disadvantage of using this in the real world setting. And then the transferability, so modifying the intensity of the exercise to accommodate the patient is highly recommended. Using things like visuals or audio cues to support instruction, and also involving the caregivers to encourage them during this exercise. And then the adaptability of the Forte makes it a valuable option since it can be used in a range of settings, especially when it is customized to fit the functional goals of our patient who is experiencing presbyophonia.
This study focuses on comparing vocal function exercises and phonation resistance training exercises to treat presbyophonia. This study evaluates short-term efficacy demonstrated by improved quality of life and the perceived phonatory effort, and it also noted the differences in patient adherence and treatment satisfaction. So 20 adults aged 16 over participated in the research. All of them had reported voice problems. Each participant underwent a hearing screening with age-appropriate hearing being reported from that. And they also had administered the mini mental state examination and the elderly depression scale short form on these. All participants were counseled on vocal hygiene practices and were assigned to a group, either receiving the phonation resistance training exercise Forte or VFE or a control group. So in the beginning of treatment, all patients actually completed the voice-related quality of life. And so then they received 4 45-minute weekly sessions with their group's treatment, and they were given instructions to practice their treatment method at home as well. So after updating the voice-related quality of life at the end of treatment, both treatment groups actually showed a significant increase in scores, unlike the control group, obviously. But the study showed that Forte might have a slight advantage over VFE, mostly just due to it having a higher intensity treatment or being a higher intensity treatment. So that better addresses the overload principle that's required to actually increase the strength of the neuromuscular system. This second study focused on the use of Forte in the expiratory muscle strength training treatment, and it had 16 participants who completed the study in its entirety. So all participants were 55 years or older with a diagnosis of vocal fold atrophy. All the patients were sorted into two different groups, either receiving only Forte or receiving Forte in use alongside EMST. So the Voice Handicap Index 10 was used to measure the growth outcomes in patients, and the Aging Voice Index was also used as a secondary outcome measurement, alongside frailty that was measured. Baseline frailty was collected using the reported Edmonton Frail Scale.
And then acoustic measurements were taken using the analysis of dysphonia in speech and voice software. Participants in the study attended 4 45-minute sessions with their assigned group, and these sessions could either be weekly or bi-weekly. And weekly at-home practice logs were meant to be completed, but only 11 participants turned any of them in, and only 7 participants turned them in completed every week. The participants from both groups in the study experienced significant improvements in both the VHI-10 and the AVI. There were no significant differences between the two groups' outcomes, but the group treated using only Forte did report a higher vocal intensity on average when compared to the group receiving both Forte and EMST. And also participants in Forte only showed significant improvement in CPP of sustained vowels.